Well, if you have knee pain and are looking for a solution, there's a new study that you might be interested in. Dr. Christian Baldwin with San Antonio Orthopedic Group. He's with us this morning. Doctor, how are you this morning?
I'm doing very well, thank you.
All right, so there's various reasons why folks have knee issues, but you're looking for a certain type of person out there that has a knee issue. What you're doing this new study, right?
That's correct. So we're looking at patients specifically that have a cartilage injury.
Okay.
And so what the cartilage is a piece of tissue, as you can see here on our diagram. It's a soft white tissue at the ends of the bones that allow the bones to glide smoothly together.
Doctor, how do most folks get an injury like this?
So it can be a couple of different ways. The most common one is an acute traumatic injury. Sometimes it can occur with a ligamentous injury, such as an ACL tear.
Sports?
That's correct.
Okay.
Sports, falls, twisting injuries.
You know, if somebody's watching at home, they're like, I think I might have this kind of injury. What are they looking for? How does the knee act and how does it feel? Right.
So a lot of times you'll have swelling. You'll feel the knee being real big and a lot larger than normal. You can also have a popping, clicking type of findings in the knee.
Okay, so how is this NeoCart? How is it different than treatments before?
So currently the standard, what we do for this is we do what's called microfracture, and that's creating holes in the ends of the bone to stimulate new growth, new growth, and new stem cells to come in and form new cartilage. Now that forms scar cartilage, not as good cartilage as what we normally have in the knee, native cartilage. And so this new study actually takes your own sample and it grows it in a lab, and then we can reinsert it and have good new cartilage.
Oh, wow! So that is it's brand new then.
Well, it's been around for a while, and obviously we're now evolving into different techniques and specializing it. Okay. And so that's what this study is about.
So what are your hopes for the NeoCart?
So obviously we want to have better results than we do with traditional, what we call microfracture. Okay. And so that's the hope with this study. Okay,
and just to kind of revisit again, the old way of doing it was to make those holes and kind of scar it up, and in the hopes that you would grow new cartilage.
Correct. So microfracture, you basically stimulate the subchondral bone, the bone underneath the old cartilage, to have a blood clot form. That's correct. So here's a little defect here. So normally in microfracture, you scrape this out, and we make little holes, okay? So that's why it's called microfracture. And then you get blood flow that comes out, and over time that forms scar cartilage. Okay. With the new technique...
But the old technique, it didn't really... a little spotty, I guess?
You know, not as good as we want. We're always looking to improve, right? That's what we do in medicine. We're always looking at having scientific improvements. And so that's what this study is about.
And who's eligible for the NeoCart?
So we have patients from the age of 18 to 55, and we're actually now looking at increasing that to 59 years of age, that have a significant cartilage injury. Okay, you can't be a smoker. So that's one of the excluding factors there.
Why is that?
Well, it can have detrimental effects on healing, and specifically on cartilage healing.
So you won't get an accurate reading on how good the study is doing than if you're a smoker.
That's correct.
Okay. Well, that's great. Hopefully we'll be able to help some folks out there with this new NeoCart. Sounds fascinating.
Well, thank you. Yeah, we hope so, and again, it's showing great promise.
Okay, so call today if you've got knee pain and you feel like this procedure can help you. What you want to do is you want to text KNEE9 to 87888. Again, that's KNEE9 to 8788, and give them a call. You can give them a call as well, 830-477-0607, or you can always go online. Just visit neocartimplant.com. Doctor, thank you so much for your time.
Thank you.
And just fascinating stuff, and hopefully we'll help some folks out there. Stay with us. We'll be right back.